Parag Dashatwar. I'm a consultant gastroenterologist and hepatologist working at KIMS Hospital, Secunderabad. Today, on the occasion of World Hepatitis Day, I'm going to talk to you about what is exactly is hepatitis. So let's jump into it. What is hepatitis? Hepatitis, the word itself means inflammation of liver. Any uh, condition which causes liver injury and liver swelling is called hepatitis. So, what are the causes of hepatitis? Why there is liver injury? There are predominantly four major groups of liver injuries. One is infection with certain viruses, which is usually known as viral hepatitis. There are majorly uh, four types of viruses which are known to cause hepatitis commonly, and then there are rarer viruses. These viruses are known as hepatitis A, B, C, and E. D virus is relatively rare in India, and it is only found in certain situations. Apart from viral hepatitis, most common cause of liver injury in our setting is excessive use of alcohol. Excessive alcohol consumption can also cause liver inflammation, swelling, and hepatitis. Say, followed by that, most common cause of hepatitis is use of drugs. These drugs can be prescription allopathic drugs, as well as more commonly it is found with the Ayurvedic and traditional remedies, herbal remedies. These drugs usually are not studied in a rigorous manner before being launched in market. So we do not know about exact toxicity profile of these drugs. So most of the time, patients who present to us without an history of virus infection or alcohol abuse, and they have significant hepatitis, we have to think about drug-induced hepatitis. Uh, Apart from that, there are certain situations where you can have liver injury or liver inflammation or swelling. These are like autoimmune hepatitis. Autoimmune hepatitis, the body reacts against your own tissue, that is liver, and it causes inflammation and swelling. Um, so now coming to what is alcoholic hepatitis? I mean, which is the most common scenario in our country? What is alcoholic hepatitis? Alcoholic hepatitis does not happen in everyone who drinks alcohol, but it is hard to predict among people who are drinking alcohol who will get the hepatitis. This alcoholic hepatitis can develop after a regular use of alcohol, as well as use of alcohol once in a while in a binge manner. Everyone has a different body composition and different sensitivity to alcohol. Um, Traditionally, people who have been drinking daily in excess of two standard drinks uh, of hard spirits a day, more than several years, like 8 to 10 years, they develop alcoholic hepatitis. 90% of them develop alcoholic hepatitis. Apart from that, if you are drinking alcohol in a binge manner on occasions, but in excessive amounts, that can also cause alcoholic hepatitis. Alcoholic hepatitis, if it occurs in a severe form, it is a life-threatening illness with 50% chance of death within 1 month. Minor forms of alcoholic hepatitis may still recover, but severe alcoholic hepatitis is a dreaded disease, and there are not many good treatments apart from liver transplantation. Uh, in the long term, if alcoholic hepatitis runs in the background, patient may develop chronic liver disease, or what we call as cirrhosis of liver, and he may land up in liver failure. Then again, liver transplantation is the only curative treatment available. In terms of viral hepatitis A and E are short-lived, self-limiting illnesses in most cases. They are usually spread from contaminated food and water, and these are usually found in seasonal uh, distribution, especially when you have got flood situations, when there is a generalized degradation in the sanitation. There will be certain outbreaks in few areas where you find a lot of people with similar symptoms. Hepatitis A and E, as I said, are self-limiting, but in certain situations like pregnant women getting hepatitis A can have high rates of adverse outcomes for both mother and child, and there is also a significant risk of death in these patients. Hepatitis A usually self-limiting. A lot of patients, a lot of general population might have acquired it in their childhood, and by the time they become uh, immune to it. But that does not mean that you should not take precautions. Uh, Hepatitis B and C, these are relatively rare, but they are not rare as such. Hepatitis B is a chronic infection. That means it remains for your lifetime. It does not get cured. So once you get chronic hepatitis B infection, it remains with you forever. Uh, in India, about 3% of population. So with out of 100 billion people, you can imagine how many people have hepatitis with them. A lot of people are unaware of having hepatitis B infection. It is a dangerous disease. Usually, the liver damage goes on unnoticed in the background until and unless you reach a certain stage where signs of liver failure start developing. Most people don't realize that they have hepatitis B infections. And once the signs and symptoms of liver failure develop, that is usually too late. These patients are prone to develop hepatocellular cancers, and again, these cancers don't show signs in the initial stages, and when they are really progressed, then only most of these are detected. Uh, in India, we have hepatitis B vaccination program, which was started a couple of decades back. But people who are born before that age group, in that age group, they should um, do once in a lifetime screening with hepatitis B surface antigen test, which will detect whether you have hepatitis B virus infection or not. Once you are known to have hepatitis B virus infection, next step will be to determine whether the infection is active stage or not. If the infection is active, or if you have certain predisposing factors like family history of liver disease or liver cancer, you should undergo treatment for hepatitis B virus. If not, then patients are usually put on long-term surveillance where periodic liver function test and ultrasounds are done, and as and when needed, the liver treatments are started. Coming to hepatitis C, it is another dreaded viral infection. Previously, this was thought to be very difficult to treat, almost incurable disease. Although it is not as common as hepatitis B, its prevalence in certain areas is around 1 to 2%. And this is also a virus infection which silently goes on in the background and causes long-term liver damage and liver failure as well as liver cancer. Since last 5 to 6 years, we have got very good drugs to treat and cure hepatitis C. Mark my word, cure hepatitis C. Hepatitis B we cannot cure, but hepatitis C we can cure with the currently available medications. So, uh, although there is no vaccination for hepatitis C, there are very good cures for hepatitis C. So, what I said about hepatitis B goes true for hepatitis C as well. You should do once in a lifetime screening for hepatitis C virus infection, and if positive, you should immediately get treated if the virus infection is active in your body. Now, coming to the other rarer causes of hepatitis, like autoimmune hepatitis. Uh, Autoimmune hepatitis usually develop in younger female age group, and they have other autoimmune diseases as a predisposing factor, and they can also similarly present with sudden signs of liver failure. Unfortunately, it is there are no good studies to um, suggest that screening general population for autoimmune hepatitis is worth. But as and when uh, there is a need, you should check for autoimmune hepatitis as well. So now coming to what are the signs and symptoms of liver disease? When should you suspect you have hepatitis? Um, Hepatitis comes in two flavors. One is acute hepatitis, another is chronic hepatitis. Acute hepatitis usually is associated with signs and symptoms like loss of appetite, anorexia, nausea, vomiting, generalized weakness, fevers, or yellow color discoloration of eyes and skin, itching. abdominal pain. So these are the constellations of signs and symptoms which suggest hepatitis. Once you have got the suspicion, you should always visit a doctor and get adequately tested. Um, Sometimes, if your hepatitis is severe, um, uh, you may have loss of consciousness, accumulation of water in the stomach, leg swellings. So these are usually alarming sign, and immediately patient should be taken to the hospital. What are the complications of hepatitis? Like I alluded previously, complication of a hepatitis which is untreated and goes on forever, especially chronic, can lead to chronic liver disease, cirrhosis, and liver failure, and also hepatocellular cancers. Another dreaded complication of especially viral hepatitis and autoimmune hepatitis is that acute liver failure. So, if the injury is too severe, body does not give you time to recover from it, and it lands into acute liver failure where liver shuts down. And this is usually a medical emergency, and only good treatment here are again liver transplantation. So, what are the preventive measures that one can take for preventing hepatitis? So, like I said, uh, stay away from alcohol. There is no safe limit for alcohol drinking, and it is not recommended. So, if you can stay away from alcohol, that's the best. If you have to drink, drink in moderation. So, that is less than 2 drinks a day for male and less than 1 drink a day for female. But that does not mean that this is the adequate intake or this is the recommended intake. No alcohol is good alcohol. You should get checked for hepatitis C and B virus infection once in your lifetime, and if they are uh, detected, then you should get them treated. Second is, do not use any herbal, Ayurvedic, or non-descriptive medications given by quacks without understanding the composition, consulting the appropriate specialist in the matter. Uh, because a lot of drugs can cause hepatitis and liver failure. Then another, apart from this, there are not many things that you can do to prevent hepatitis. Uh, for a healthy liver, what you need to understand is that there is a silent epidemic of non-alcoholic steatohepatitis or NASH, which is because of diabetes, obesity, hypertension, and high cholesterol. So, adopting a general good health, a good lifestyle pattern will help in preventing hepatitis. So, I assume my talk had been helpful to you in understanding what is hepatitis, what needs to be done, and what are the precautions. Thank you.